Should I go ahead? Hi, good evening, and good morning, and good afternoon. This is Dr. Shams. I am in Muscat, Sultanate of Oman. I am a physician and a health psychologist. I hope and wish everybody who is listening today, they are safe in your home and doing quite well. I have been invited here to talk about the coping mechanism and how to cope with the psychological impact of quarantine. Now, whenever there is a communicable disease, a spread in community, the health system as well as the healthcare system of the country, they require and implement multifaceted approach to control the spread of the disease. Some of the strategies that the country use is education of the medical provider, provision of treatment and prophylaxis, if there is any treatment available, isolation, quarantine, and lockdown are various measures to control the spread of disease. And this is the topic that I'm going to talk about. Quarantine is actually a separation and restriction of movement of people who have been potentially exposed to a contagious disease to ascertain if they become unwell, indirectly reducing the risk of the disease to spread. Now, most recently, the quarantine has been implemented because of the and used in the coronavirus COVID-19 outbreak. This system or this approach is not quite new. It was used years back in 2003 outbreak of SARS, where in China and Canada they used the same strategy. The entire villages of Africa were quarantined during 2014 with the Ebola outbreak. So what's happening is that if you look at this, the diseases are presenting itself with a different sign and symptoms. The diseases might be the virus and the communicable disease are different, but the reaction of the people to the quarantine and the process to restrict this disease, the spread of the disease, are the same. Now the question comes that why this time the quarantine, the WHO and other healthcare authority were encouraging the researcher to find out the psychological impact of COVID-19 and how people are reacting emotionally to this quarantine. It has been found and research has validated that quarantine is quite an unpleasant experience for those who undergo it. Separation from the loved one, loss of freedom, uncertainty about the disease, and particularly in this case when there's no vaccination and treatment so far, boredom, frustration, substantial anger, and the lawsuit has been brought in attention. There were cases of suicide in the previous spread of communicable disease, and there has been registered and reported the suicide and attempt of suicide in COVID-19 as well. Given this all developing situation with coronavirus, policymakers encourage and WHO to talk about, to find out what is the psychological impact of this of quarantine in people who have going through the quarantine or will be going through the isolation. When they found the impact, they also talk about and discuss what are the factors that can be implemented to mitigate the effect of this quarantine. Now, before I go to the impact or psychological impact, let's see. There's a group of people which are considered a little high risk, and they are more prone to have the psychological impact or negative psychological impact of quarantine. These include people who have unfortunately a history of psychiatric illnesses. It has been found the people who had previous history of mental illness or psychological problem, they experience anxiety and anger even 6 months after the release from the quarantine. One. Second are the healthcare workers. Secondly is the healthcare workers who had been quarantined had more severe symptoms of post-traumatic stress disorder than the general public or those their fellow workers who have not been quarantined. Young population between 16 to 24 years. It was reported that this young population has a highest level of psychological distress. Which shows that this population might be required highest specific intervention and psychological support during the quarantine and post-quarantine. It was also discussed that it is a possibility the elderly who are more vulnerable to the physical attack from COVID-19, but it is the young population who might be least immune to the longer term mental effect once the quarantine is over. In 2019, when the COVID-19 started spreading and the people get aware of that, the researcher conducted a study in Greece with about 1,000 university students to find out what is the impact of the lockdown or quarantine in the mental health of the student. They found in the result of this study that there was a horizontal increase in scores, which shows 42% of the people, of the children, of the young population were having anxiety. 74% sorry. So where the study was conducted on 1,000 university students concerning the impact of the lockdown or the quarantine on the mental health status of the student. And surprisingly, they found that there was a horizontal increase in the scores as a result. The results showed that 42.5% were going through anxiety, 74% having depression, 63.3% having suicidal thoughts. Total, the quality of life would worsen in 57%. As far as the literature is concerned, I believe this was the first study reporting the data concerning the impact of lockdown or the quarantine on the students. However, the result is obvious and is quite clear that there is or will be a specific need of a specific intervention concerning the mental health issues. Let's see. So this was all about the high-risk people. What is quarantine? Let's look at the impact of the quarantine. Now, generally, we all know that it leads to poor economy. It leads to unemployment. But what I am more concerned, and my focus is on the psychological impact of the quarantine and lockdown. Now, recent literature as well as the previous literature who investigated about the impact of quarantine, they found it leads to emotional disturbances, it causes depression, stress, sleeping difficulty, irritability, and anger. If the mass social isolation is likely to result in mental health, result in mental health difficulties for considerable number of people, means that if there is a mass isolation, social isolation, that we will see mental health issues in a mass population. Confinement, loss of routine, reduced social and physical contact from others and the loved one lead to frustration as well as the stress. On the top of that, the people, most of the information the people are getting, it can be fragmented. This is inadequate. There is a financial loss, which is further adding the stigma. And some researchers also suggested that it has a long-term effect on the mental health. It was also registered and recorded, as I mentioned before, about the suicide. It's a very interesting study was conducted in Taiwan hospital following the SARS outbreak in 2003. They found that almost 930 staff were ordered for a quarantine of 2 weeks and was expected to perform the let's see if I can. Just give me a second. I'm having a little technical difficulty here with the. I'm getting question from a person about the coping in this situation, and I can explain this coping mechanism in a while after going through this little about the impact. Now, what they found was that in Taiwan, that the people who have been and the doctors who have been in quarantine, they were quarantined for about 2 weeks. Now, all the 240 patients saying the hospital were banned from the hospital ordered them to stay, and they were banned from leaving. It was kind of a forced quarantine. It was found that within 2 or 3 days, the people, 2 of the patients who had a history of depression and who were confined, they found that one committed suicide and other attempted suicide. So it's a pretty serious situation of the quarantine and how the people go through, take it while they are in quarantine. One important link with the psychological resilience during quarantine, it is the fear. It is the biggest stress that the people go through. That it is the fear that if I am having quarantine or I am having a coronavirus, I will be passing it to others. And while they are quarantined, a small symptoms of headache or a flu or any of these symptoms, they believe that it is associated with the coronavirus. As a matter of fact, it could happen that they might also be going through anxiety disorder. And the presentation of the anxiety is very much like a cold symptoms. Now, the presentation can be this headache, body ache, or a cough, problem with the breathing. These symptoms, it can also be of the anxiety, but it is taken as people are having not anxiety, but they believe that they are going through this coronavirus symptoms. And the fear is, since I can have, somebody else can have from it. There were, in another study, it was found that the people reported fears that of their own health, and they might get this while they're in quarantine, and they were also fearful that they will give to somebody else. There was also there were also reported some of the incident of interpersonal violence. Now, when the people are not getting an inadequate information about quarantine purpose, or they are online getting the information from the Facebook or from the social media, this fragmented information of different levels, they further are proved to be more stressful. Media and misinformation, excessive media and misinformation has lots of more stressful responses. This is what all about. It is that during the people who are going with quarantine or have in quarantine, the long-term effect of quarantine has also been seen, which is pretty much the similar as people avoid handshaking, hand washing, avoid the crowd, and this elevated and they have elevated mental health problems that includes PTSD, anxiety, depression. Now, in another report, it was mentioned in the people who were quarantined during the SARS, they had they have the signs and symptoms of acute and chronic mental instability even after 3 years. People were using, they become alcohol dependence as well as alcohol abuse even months and months and years and years after the effect of quarantine. Now, all these symptoms, all these mental health issues that we are seeing in normal population who had undergone quarantine, it is exaggerated with the healthcare workers who witnessed the patients and the first line healthcare team. So the feeling of guilt, feeling of helpless, nervousness, sadness, this is all has been seen as a long-term effect. Another thing that I heard a lot and I read about it after the post-quarantine, it is the stigma. People live like a stereotype attitude. People go through a stereotype or they live with a stigma. Now, this stigma that they were once quarantined, it becomes more difficult in the future for them to get the job, or it becomes more difficult for the people to interact with others. They have been seeing social withdrawal, and this leads to further stress even after the quarantine. Not only months, weeks, but like weeks and years, people go through this. So the stigma is another factor that causes further stress and distress. Now, so this is like a short during the quarantine period, and the long-term effect of the quarantine. With that, we come to the main topic, which is how we cope with the quarantine, the impact of quarantine. And it was important to show a bit of the effect of the quarantine before I tell you how we cope with it. Now, it has been discussed, it has been found that during the major infectious diseases, quarantine is necessary. However, it has some negative psychological effect. not during, but as well as after this, after after the quarantine is over. Therefore, it was suggested that when people are going for the quarantine or they have been quarantined, it is important to give them some tools, some support that they can use to decrease, reduce, or combat with the negative psychological impact of quarantine. The one thing that has been highlighted in the literature is the quarantine should be as short as possible. Studies showed longer the quarantine period, the poorer the psychological outcomes. Even a slight increase time after the quarantine period, it has been seen that people go through more frustration and demoralization. It is the need of the people who are going through the quarantine that the government provide them maximum information. Why they have been quarantined, the purpose of the quarantine, how they can get help, and so they should be fully informed, well informed before they have been sent for the quarantine. Now, this information help people to reduce their anxiety as well as the stigma. The first thing is that I wanted to discuss is about the fear of infection. People that any kind of symptoms that they have, they believe that it is due to the corona. Now, when they put their preparing their like ways that who will be their support system or who they can talk, it is important that they have they should have the name of the caregiver provider who they can call, or local clinic telehealth, to check with them the symptoms that they are going through. So this is the fear of infection. They can take care by, should be having the list of the doctors as well as who they can check. Please don't go online, social media, and different sites to talk and discuss about about the symptoms on quarantine. It has been seen, the more you read the media, the more you try to understand through social media, the more anxiety and stress it comes on the surface. So you learn about the symptoms of coronavirus from the public health or the health official department, which are reliable. Frustration and boredom. Confinement leads to loss of usual routine, loss of social and physical contact, and increase the sense of isolation. Now, this thing, frustration, is the most effective thing that I have noticed is that you should be following a routine to wake up, exercise, lunches. Don't be out of the routine. Secondly, schedule different activities. Don't be very judgmental. Don't be compassionate, and find activities that you can do on your own, which includes the baking, includes cooking, playing a music. If you wanted to take any course, online course, this is the time. If you wanted trying different skills, rather being very critical on yourself that I can't find activity. Make sure stay connected with your friends and your family. Make a list of the people that you want to check on and off. Activating your social network remotely is not the priority, but something mandatory, because this is going to help you to combat and reduce the anxiety, as well as in the long term. Keeping in mind, in your list, try to see those people who can give you like a positive messages and vibes. If I am feeling very low, or I am depressed and I'm anxious, and I call somebody who is like a mirror image, you can imagine that this won't be helping me. When I'm going to hang up the phone, probably I will be more anxious about. For people who can provide some lighter mood, people who can give accurate information, I will pick those kind of people. Those should be in my list. One more thing I want to add here when it comes to the social circle, that during the stress and the distress period, we know that these are chemical release, this increase the heart rate and have the physical symptoms. But underneath that, in or parallel to this hormones, these negative hormones or bad hormones, the body release automatically one chemical and hormone which is called oxytocin. Oxytocin helps to improve and increase our social interaction. It is a hormone that counteract the effect of cortisol, which is the main chemical that is released during the stress and increase the heart rate and other issues. It is automatically released during the period of stress. This particular hormone is also called a love hormone and the hug hormone, because when we got physically interacting with people, this hormone is released. So during the stress, the more you get in contact with your people socially, the more you release the oxytocin, and oxytocin counteract the stress level. The other thing is the physical exercise. This year we are talking about the frustration and getting bored. Physical exercise is important. There's no doubt about that. It has been confirmed that 7 minutes of workout or yoga or any exercise that you like, you wanted to practice, you just go ahead with that. Nowadays, and which I have tried also, it's called exergame, and these are the exercises that you find online, different kind of, and it is mainly designed when you are by yourself. Since exercise improve our immunity, decrease the stress level, improve the mood, our mood, therefore exercise, it should be a part of your routine. So exercise your social circle, scheduling activity. I would be scheduling the activity 1, 2, 3, 4, that what I can do when I feel bored. It has been also reported that people have an inadequate supply of the food, clothes, and water. So it is better that you have a good supply for 6 months when you get information or when you're being informed about the quarantine. If you have extra food, extra medical supply, consider donating to the local food pantry or hospital or your next door neighbor. The altruism, helping people, it helps to reduce the stress as well as the chemicals that lead to stress. Inadequate information, make sure that you getting the information from the credentialated healthcare professionals as well as the health agency. It has been found that the people who listen news, listening the news for a longer time, getting the information from the social media, it adds further stress. So lack of transparency or conflicting information further add confusion and frustration. Next is the sleep. Now, as you maintain all your routine, make sure that your sleep pattern, like exercise and working, it is also well scheduled. It is important to have a regular sleep routine. For most people, 6 to 9 hours are sufficient. But what I have seen that during this quarantine period or during the lockdown, there's so much happening. And when we try to sleep in the night, when we have the time, we are not able to sleep because this is so many thoughts are coming, and this like a bombardment of the thoughts at that time, and this can lead further insomnia, which is lack of sleep. Now, one technique that I found very useful for insomnia, and today I want to share with you because my own daughter is in the United States, and there was a time I was very stressful about this whole situation. She was not with me. Now, when you feel that your thoughts are taking you, and there's like a rush of the thought, leave the bed. Don't stay in the same place. Open your journal or your laptop, and in that laptop make 3 columns. One is a worrying list, second, what can I do, and third is how do I move on. So in that worry list, 1, 2, 3, 4, 5, put all the worries that you have, so you can see yourself that this is what I'm going through. And then secondly, you can write about what can you do about that worry. So in my case, since my daughter was in America, and the thought is, what if she get the corona? What if she get a quarantine? What's going to happen? I start putting that down, that in the bad worry list. And then I put, what can I do? I can make a call. I can call her friends. I can call to check how she's doing. I can call her directly. And how do I move on? I like to do exercise. I like to talk. I mean, I believe if I get in touch with my family and friends, I'll feel better. So in this way, I make the full list, and whenever I have this worry thing, I can open the list. Once you have written all that, then you try to go back to the sleep. The chances are high that what is going in your mind, you put on a piece of paper, and you feel that I have more control on it, rather that I'm feeling very helpless with the situation. Once this is done, then you can open your the YouTube and practice any of the mindful meditation exercises. Mindful meditation exercise bring you back into the present moment. You become more aware of your own thoughts and emotion. This way, it helps you to relieve and relax. So now I encourage my clients that when they if they wanted to this worry list thing, try to do it half an hour and an hour before they going to sleep. Try that and see the difference. It is called, so this is my worry list, or this is my worry time. Put everything together and see the difference in your sleep pattern. The other thing is, which as a health psychologist I do talk about and recommend, to stay in the present moment. The importance, normally when we are in stress or we are nervous or anxious, the thoughts take us either in the future, when this will be over, what if I have a disease, what if something happens to me, what if my family is going through this thought process is going. This is like a cycle that goes on, and it further makes us more nervous, more anxious. We encourage, you have no control of the future, and you have no control of the past. Thinking about, if I haven't gone this, if this not happened, if this is, so we don't have the control on the future and the past. What is we have the control is in the present moment, and this moment is the one where you are breathing, when you are alive. The rest you have no control on it. This is the moment you have the control. So we encourage people to stay in the present moment. Now, when you look, or when you try to stay in the present moment, you get off the automatic pilot thing. You are giving your brain a chance to process the pleasure and release those chemicals that increase your that elevate your mood, which is also called a good neurotransmitter, and that is the serotonin. It helps to elevate the mood and bring you calm. Now the question is that how you're going to come in the present moment. There are two main exercises that I suggest my clients, and they reported back to me that they really help them. One is the mindful exercises, and the second is it is called STOP. STOP is an acronym. Is when, let's say, you are under stress or you are under distress and lots of thoughts at the time is coming, and like a bombardment, like a forcible army, and most of the time under the stress the thoughts are very negative. When you going through this, you say the word which is called STOP. As I said, it's an acronym, which is, now this will be STOPP. S, you say the word stop. T, you take a deep breath, like one slow deep breath. When you do that, you shift your attention and focus on the present moment. O is observe. Observe what is going in your mind. Observe with your emotions. Observe what is the body sensation are. P, and then you pull back yourself and look at, is there a different perspective of the stress or the situation? Is there any other way I can think about this? What advice I'm going to give to a good friend of mine if she or he is going through this quarantine? And the other P is practice and proceed. Stop, I have found extremely helpful. It takes you out from that particular situation which is considered very stressful, or from those thoughts into the moment where you are more aware of the present. That diffuse those negative thoughts. So keep this. You can make a big chart and remember the stop sign. You can make a chart like that, STOPP, and practices during normal days when or any moment when you want it. Gradually, since the brain has the capacity to change, you will be surprised that if you have practiced it well, after some time, when you are under stress or when there's a bombardment of thoughts, your mind will automatically pull you back from this loop of the cycle of the negative thought. You will be able to observe it, and then you decide how do you want to take an action. So there is a small gap from the negative thought and making an action. And during this window period, you can decide, you have a control. That should I take this, or should I act on that, or should I not? So remember the stop. The other thing which I also tell the people when they're under lots of stress, especially in anxiety, when there's a bombardment of the thought, and to come to the present moment, it is called that I teach them that from to bring yourself, like coming to the present moment, is what do you call that? The word, I can't remember the word of that. That use your all five senses to bring yourself in the present moment, and which also called as a grounding. So if you are going through lots of these thoughts, frustration, anxiety, and the thoughts are that again, why, when, all that, you start using your five senses to bring yourself into the present moment. Now, so how do I tell the people about this is, remember that 1, 2, 3, 4 size. Pick one thing that you can see at that time. Pick 2 things that you can touch. Pick 3 things that you can smell. Pick so it's like a touch, see, hear. So you can pick like 4 things that you can hear. So traffic light, and that is all happening at this moment. Bring your 5 senses right away to bring yourself in the present moment. Now you can make a list of that and put in any box. And if you feel very distracted or you feel very anxious, you can open that and start looking at what are the things that I can do. So you have a candle you can smell. You have a candy there, you can eat it. You have a clock, or you have a music, or your phone, you can play the music to hear. To touch, you can have, so you can have like different things that you can touch, that can bring you into the present moment, and that is called a grounding technique. That has been proven extremely effective at the time of PTSD, and that is a part of anxiety. So if you wake up in the middle of the night because of your stress or anxiety, bring yourself into this moment, because this is the moment which you have control on it, and the past and the future, you have no control on that. One is gone, one isn't come. You can, so this mindful exercise, stop signs strategy, as well as the grounding exercises, these are quite found to be beneficial and during the time when we are getting anxious, frustrated, and the body is giving us the messages, which is increased heart rate or pain or headache. You can put different stickers, like a post notes, in your room where you are being in quarantine. So whenever you want, you can take a look and pick one. So exercise, baking, making flowers, writing, journal writing, you can pick any of these activities to make yourself feel better. All these exercises that I am telling now, that you can apply not only in the quarantine situation, but in any situation that bring little difficulty, or that you need to cope in more appropriate manner. As a health psychologist, we discuss a lot, and I tell this a lot to my patients. The last one is the positive thinking. Now, the positive thinking helps to build up your immunity. Now, there is a cycle of thought and feelings and the behavior. So if you are thinking everything in a negative way, if you're thinking that, yeah, if I have corona, if I am in quarantine, I will definitely I will become sick, or I will pass the disease to my family, and this is going on. This is called the catastrophizing the situation. There is no, though there is not an evidence that if you are in quarantine, you are COVID positive. There's no evidence, but this is the way the message, the thought comes to you. And we react not to the corona, then we are reacting to the negative thought. And therefore, it is advised that have positive thinking. Now, one method, one strategy again that you can use with the catastrophizing thought, it is called decatastrophizing. In this, this is mainly designed by us by the psychologists at the time of anxiety, when the people are very anxious about, and again, multiple negative thoughts trap them. Put your worst fear. So let's say my worst fear in this situation, in lockdown, or let's say it's about my own parents, that if I'm going to visit them, I can pass this disease to them. So this is the biggest fear, that they can get sick. And how likely is this? What are the chances that can happen? From 10 to 100%. So the chances are that whenever I go to meet them, I am putting the mask, I am taking all the protective measure. The chances are not very high. But I will not think about that this will not happen. We are talking about if the worst fear is my parents get it, and I am telling that let's say 50% chances are they get it. Though I'm knowing that I'm doing all my protective measure when I meet them, but let's say it has it. What would I do if it happened? How would I cope with it? So if they have it, now the question is, in case if they have it. So the first is on admission, hospitalization, this, what I can do for them. So first thing is that I am working on the worst scenario if it happened, how I'm going to cope with it. So this fear that I am living, the fear that I don't want to face, and which is causing lots of anxiety, now I'm facing it openly. What worse could happen if this will happen, if this occur? What worse could happen if my daughter is in the United States, get corona, and she is in quarantine? So what are the chances? Well, let's say 60% chances or 30% chances. What could I do? I am here in Muscat, in Oman, in a different country. She's in the United States. She is with the family, other family member. They can take care of her. What is the most likely outcome? If I am coping it most appropriately, in an appropriate manner, and I'm taking my parents to the hospital, they can be in that. So what most outcomes, the possibility is that they can be recovered. They don't have any medical problem. So what you're doing is catastrophizing the problem, rather getting into the loop of this catastrophizing moment. So I am in quarantine. What if I am coughing, or I am sneezing, or I have a headache? This might be corona. These symptoms might be the COVID-19. The worst fear is if I have it. What are the chances? So 30% or 40% chances. What will I do if I have it? Well, I have a list of authentic, proper doctors, and name of the doctors and the clinic. I'll call them. I'll talk to them. I will take the medicine, whatever prescribed. The chances are I could recover. Now here you are not running from your fear. You are facing it. The people who we talk about who are vulnerable, who have a high risk, it involves the people who have previous mental health problem. In that scenario, it is important that they should be, their family members, they themselves, as well as their community and their doctors, they should be having all these, the list of their psychiatrists, psychologists, and the social workers. Now, this is important that the family members also understand the isolation and confinement can not necessarily, but it can lead to further stress and anxiety and depression. So they should be prepared. Telephone call, online clinical, the team of the healthcare, psychiatric team, social worker, they should be having that information. They should be having the information of the friends and the support that they can call. So rather taken as stigma, this we can work on. Rather taking this stigma, we can work with them. Now, similar is a situation is with the physicians and the doctors. In case if anybody is in quarantine, as I mentioned before, they have more severe psychological impact versus the people who have not been quarantined. Now, their friends, their family, and it is also it's advisable that when they make a call to the healthcare department or the places that when they need the help to address their symptoms, there should be a psychologist or a mental health care team, so they can share their issues and that can be addressed before it reaches too far. So making a routine, again, when you make a routine, you feel empowered. You have control on that, on your activity and your attitude. You have no control when the drug treatment will come, when the quarantine will be over, or when the lockdown finish. You have no control on that. You have a control on your attitude and what you can do at that moment. So make the things more routine. If you have a social circle, make sure you bring that all in, stay quite in touch with them through online phone calls or the electronic media. Remember, at the time of stress, the hormone that help you to stay in touch and interact with your family friends and bring this empathy, it is oxytocin, and it releases when the more we meet with the people. Having the list of all the coping skills. It should be pasted in your room. It should be in your pocket. Mindful meditation, stop strategy, grounding strategy, decatastrophizing strategy. These should be there, and you can use whenever you feel like. Make a routine with the exercise. Make a routine with your food, your dinners, lunches, your to food for the time, the timing that when you like to have the dinner, and it should be static. Don't make it a chaos. Pick activities. Be compassionate to yourself. Don't look for activity that is too complicated. Pick simple activity that you can do, and that should be pasted or it should be in your pocket. So you can do it when you feel under stress. You should be having the numbers of your psychologists, your community leaders, your mental health. In case if you need, you can call them. As a matter of fact, and from my side, I checked during this quarantine. I on and off call my most of the clients who I knew that had going through some struggle phase before this corona and before the lockdown. So I keep an eye and keep checking on them, that how they are doing overall. Most of them shared with me that they are stressed and they are anxious with this. So, but the message that they get from me is, I am here for you, and if you need, I can support you. So just talking and sharing their depression or their anxiety, at times it helped them. If needed, then we can suggest the medicine. So telemedicine and psychiatrists, this is all should be in place. Activities, baking activities, all these, this is a part. Make sure you have enough food supply, enough things that you might be needing during the quarantine. And as a matter of fact, the best advice is that the quarantine should be brief, short-lived, not too far. And whenever the pandemic is over, the government responsibility is to encourage people to meet them and interact them physically, rather social distancing. With this, I want to make a conclusion that the review now of COVID-19 and the previous literature has showed and suggested the psychological impact of quarantine is wide-ranging, substantial, and long-lasting. This is not that, then it doesn't mean that the people don't go in quarantine, because this is the way we can prevent the disorder. But the conclusion is that if the quarantine is explained in a way and well explained, well described, and giving a message that it is a part of altruism, that your sacrifice can make a difference in someone's life. Your effort can help other people. Then people will not go through so much stress and the anxiety or helpless or hopelessness. So how it is projected, how the message comes to the people with the quarantine, it makes a big difference. Keeping in mind the compelled quarantine versus quarantine that altruism is a different approach, and the mind see them in a different way. Rather giving them fragmented information, purpose of quarantine, how this is going to help others. So they don't live with this stigma. They are out of that, and they feel good about that. Their sacrifices is helping others. They are given good coping skills. They have resources. They have well informed with the quarantine. It can help them to recover from this quarantine phase or lockdown in a more stronger. They emerge more stronger, rather feeling hopeless and weak. In the end, I would like to tell you that every trauma or every crisis that we go through in life, it if it is processed well, if the coping skills are sufficient and effective, people emerge with this trauma much stronger, not resilient, but stronger than they were previously. The function level, the coping skills, the way they see things, they become more stronger. The point here is that you have the point is that you should be having enough and appropriate and positive coping skills that you can use to combat the trauma, rather just go in the flow. And one thing that helps is here how you perceive it. What is how you perceive it, the stress, rather the stress itself. I just gonna go back to these if any questions are there. Now, what are the psychological effect of self-isolation beside depression, anxiety? Now, I am telling you from the literature only that has been pointed in the past as in the present. The top is the depression, anxiety. Keeping in mind the depression and anxiety is the extreme spectrum or extreme sides of stress. In addition to that, you will find difficulty in sleeping. It is again related to the anxiety. Emotional disturbance, not necessarily only depression, but people show anger. There's a sense, the cases of the domestic violence. The people who have the history, or the women who have lived with the domestic violence situation, this particular aggression has seemed to rise. What else? Irritability, low mood, PTSD, post-traumatic stress disorder, that has been seen, acute stress disorder and PTSD, that has been seen in the long run. So it's indirectly, it impacts a lot of your psychologically impact a lot. In addition to the one I told, the feeling of frustration, feeling of guilt, nervousness, loneliness, worrying all the time, that is, and the stigma, that is also seen, that has also been seen is a long-term effect of the coronavirus and COVID-19, as well as quarantine. Now, to consult me, if you have, I tried my best to provide maximum information of this, but in case if something is missing, I apologize, and you are more than welcome to contact me through the council, as I am a part of the council, this organization, and I'm a therapist, a psychologist with them. Now, there was one question there. How can we better ensure situation that is happening right now in the COVID? Now, as I said, coping with this, I provided you not just stress management technique. I provided you definite, concrete method that you can fight back with your stress or with the situation. And 2-3 things, there is no way that it can fail. One is grounding, second is the stop sign, and the third is decatastrophizing. Challenge your own thoughts. If you look at this, that I am sick, or I will get sick, or I will say more people sick, it is not 100% happening, but this is the way your thoughts are, and you are reacting to the thought. Somebody is asking that it's related, everything related to coronavirus is overwhelming. Recommended to watch the news to stay up to date, or just forget about it and just check important announcement. Well, I'm giving you my example. Initially, when it started, since my daughter is in the United States, I was mental, I would say. I was to watch the news. I was watching probably 3 to 4 hours because I just want to keep myself posted what is happening in US, what is happening in Muscat and all that. And I realized, no, it was not helping. And this has been documented in the previous literature with the pandemic situation, as well as in this. Too much information brings nothing but more stress. I will keep myself updated. I would recommend keep yourself updated. What we should be taking to build the immunity, what is necessary now, how do I go? Go with that. Keep yourself updated what is happening in the world, keeping in mind so much information. And then what happened, there's some of this information is very fragmented. It's not helping us. If you feel yourself that you are very strong and you're ready to watch it, it's your call. But if you ask me, I would say I will limit my time of reading the news. So in the morning I have 20 minutes. In 20 minutes I watch CNN, I watch this, and that's about it. And then I will move on. Continuously watching this TV is adding nothing but anxiety and feeling of depression, because media is not showing anything positive. I just want to add here that when my family members, they send me this information that 3,000 people got in Muscat coronavirus, 10,000, I always ask them, please tell me those who are recovering from it. So mind is like a Velcro. It attracts only the negative thing. But we have to combat and go against it by finding the positive in there. So again, what stress is there, but how do you perceive it? That is important. So when you listening the news, make it half an hour, pick the important one, and then close it. That's it. And then move on with whatever you want. Keep the worry list with you. And if you contact me, I will send you that handout of the worry list. And it's very simple. Put all the worries, what I can do, and how do I move on, and hang it somewhere. Whenever you have the old worries, pick that one. Look at it, what I can do. If it is a new worry, add in that list. As far as the good medicine to take for the, now somebody is asking about a good medicine to take in panic attack and nervous breakdown. Now, I am a physician. I am not against of antidepressant and anti-anxiety. People are taking for it, but I want to tell you one thing. So far, the therapy, I'm not because I'm a psychologist, but as the research has confirmed, the therapy, particularly cognitive behavior therapy and mindful, all these, their results are no different than the medicine. The only difference between the anti-anxiety, antidepressant, and the therapy is the time factor. If your anxiety has reached the level that it is affecting your normal day-to-day life, that you can function, you can sleep, you have this acute insomnia, I would say, yeah, start the medicine. But get in touch with your therapist. And the reason is, medicine will take care of your chemical imbalance. Medicine will take care of your symptoms, which are insomnia and increased heart rate, body pain and all that. That medicine can take care. Medicine is not gonna change your negative thought process. And what will be happening is that, let's suppose you took the medicine and it will numb all the other emotions. It will numb your anxiety. But if you have, God forbid, a second episode or having another problem in your life after this quarantine, you will be having a next relapse. The people that I see who come to me, they are not the one who first time having the attack. They come to me which they have suffered depression, anxiety about 3 or 4 times. They have tried the medicine, they were fine, and then they have a second episode when another stress comes in life. Medicine does not change your thought process, and where this cognitive therapy or the psychologist comes in picture. We give you the tools that you can use, not in this situation, but in other stress in future. And I believe in that as I said, trauma can make you and break it. if you have processed well, if you learn your coping skill, if you have changed your thought process of perceiving a stress, most likely you will be handling the next trauma in a much stronger way than this one. Any other questions that you have? Please, you're more than welcome to contact the council, and I'll be more than happy to inform you. Keep in mind that whatever the information you have today, if you need it, I can give you the handout as well, so you can practice as much as you could. And don't forget the fact that trauma not necessarily lead to depression and anxiety. Trauma can make you stronger as a person, and particularly, and this we called as a post-traumatic growth, PTG, and this was my thesis in my PhD. Post-trauma, that after trauma we become more stronger as a person. You're all welcome, and take care of yourself, and have a lovely day and evening.